And I'm a maintenance mechanic here at Magnolia Regional Health Center. I work on all the machinery here, heating, cooling, emergency generators, fire alarm systems, things like that. There's so many things that have to work together for this place to stay heated and cooled and things to run properly. I had purchased a house in Alabama and I was cleaning up the yard one Saturday. And I got up super early and just mowing and just really cleaning up because it was a fixer-upper. I was about to give up for the day and it was around 10 o'clock, I believe. And there was that one limb sticking out of that tree as I sat on the porch I'd see every day. I'm thinking, you know, I'm going to get that one limb today and then I'm going to quit. So I cut that last little part of it and it swung around and hit me and the ladder went right out from underneath. I had crushed both of my heels into roughly anywhere from 15 to 27 pieces. And then I just remember riding in a helicopter for quite a long time.
Our role as a vocational counselor is listening to the barriers, listening to what's going on in their life, and then thinking creatively about what we can do to help them get back to work. Chris, he said, you know, if I don't go do my job every day, then and the electricity went down or the generators, then the doctors couldn't do their surgery, or what if they got stopped in the middle of the surgery because they didn't have the power that they needed? He wanted to make sure the hospital ran so that the people could get their medical care. And he cared more about them than he almost did himself.
It's been a long road. I mean, you know, just getting up on your tippy toes, you know, that seems simple, but I couldn't even do that. Some of the exercises they had me do, I'm thinking, how can that help anybody? Well, these little bitty exercises they do, but when you're hurt and you're trying to do them, they're big exercises.
When someone says, I need to do something and something's preventing me from it, that's when I go into action. We just started talking and he said, I wear this walking boot. I borrowed it from a friend. And he said, the thing is, it's heavy and it's hot and my foot sweats because I'm in a mechanical setting. And he said, it gets hard. By the end of the day, I'm exhausted from walking around with this walking boot. And I said, well, you know, we can get you something. So I started doing all this research, and I didn't even know it existed until I found it. It was this shoe, a special, sort of like a surgical shoe of some sort, but it had a sole on it.
And that was the key to getting back to work. I really felt like she wasn't just doing this, it wasn't just a job for her. I mean, she was really, you know, what do you need? What can I do for you?
When Chris first went out on disability, he was told by friends and family members that insurance companies were hard to deal with, that they were difficult to deal with, that you know, they weren't even going to get him his benefit, much less anything else.
They were the bad guys. That's what everybody said. But to me, they were the good guys. They come in and like I say, anything I needed, if I had expressed it, they tried to help me any way they could. I mean, they really cared if they wanted me to go back to work, and because they knew I wanted to go back to work. And Betty, I get a kick out of her. She was terrific, really was.